You're watching Beyond the Headlines with Mike Matthews.
What is up, medical device world? I am Mike Matthews here with Beyond the Headlines. In case you went to a school that is better than Texas A&M, which is basically everybody, you can tell that there are three of us here tonight instead of just the normal two. We have our normal co-host, Hank Balch, and then we've got our guest here, Bobbert Mars. What we're going to be talking about tonight, and the reason we have Bob on the show, is we have a VA story. In fact, this one came out of Spokane, Washington. A VA clinic specializing in dental work had to cancel their surgeries. A lot of people were very upset about this because anybody who's had dental pain knows it's a really big deal, but they had to cancel many of their surgeries and their procedures due to a failure of a boiler. Bob is our resident VA expert and our resident disabled veteran. Bob, you've been in the position of both dental pain and having procedures done at the VA. How would this make you feel?
It's very frightening. I can tell you, anytime you're dealing with the VA, one of the things that strikes fear in the heart of any veteran is a delay or getting your procedure canceled, because it typically means months. And so if you hear, hey, we're canceling an appointment or we're delaying it or whatever, it's going to be literally months. The backlog is that big. So that's truly the biggest fear of any veteran that's going and seeking treatment out of VA facility.
Yeah, and I've read about that particular issue. I remember several years ago, there was a significant story that came out about backlogs of veterans needing medical procedures of various types, sometimes being put in wait lists that were 6 months long. Thankfully, I've avoided most dental pain, but for those people who have had severe dental pain, one day is torture. So when you start thinking about the possibility of waiting months, I mean, that's a pretty terrifying thing. So like we said, we don't know a huge amount about this story, but we do know that the failure was due to the boiler, which was apparently built or installed in 1949 and had not been updated ever since. Hank, what's your quick read on that situation?
As we like to remind folks often, especially when it comes to these VA stories, this is not a VA problem, right? This is a complete infrastructure problem with American healthcare, and probably for the international viewers here, you're probably saying, yeah, it's a problem in our country as well. And it really goes back to how we view our departments and our facilities in what I call a culture of catastrophe. What I mean by that is we don't change anything, we don't invest in anything until something literally blows up. Now, it doesn't sound like at this point the boiler actually blew, but it does sound like it had been past its useful life probably for a long time. And we got to the point now it was so bad, it began delaying these procedures. And again, that's waiting way too long, but it's a sign not as much of these broken VA issues, but just a broken culture across all of healthcare, in particular sterile processing, where we wait way too long to fix these problems.
Well, and I think you hit the nail right on the head, and that's going to be our word of the day is infrastructure. It is, when we define infrastructure, we are talking about the little unseen pieces that facilitate everything else. So, for example, you may have the sweetest sports car on the planet, but if the roads have 2-foot potholes, it's going to severely limit how fast you can go. So we see this problem very often in healthcare, where we have the newest, the latest, the greatest, the most awesome, braggable thing. It's up on the billboard there. And yet our infrastructure is in no way capable of supporting that, whatever it is. Bob, you've been to more hospitals than anyone else in our group. Is this a common problem that you see?
Every facility I go in, it's almost frightening. It's like when you get on the elevator and you start going down, the visual climate changes on every floor that you go down, and then you hit the basement and you're like, oh man, where am I at? What is this place? It's like literally you've stepped back into the 30s or 40s.
Yeah, in fact, I know of one specific facility that I've been to many times where it literally is like that. It's one of the most beautiful campuses I've ever been on, And yet, as soon as you go down into the basement where sterile processing is, I mean, it's like being in a third world country where you're keeping track of like what you've touched and how often you need to wash your hands and all that sort of stuff. But the point is that it's far more than just aesthetic problems. Those are just kind of symptomatic of the fact that we've ignored all the underpinnings that enable the larger, or instead of maybe not the larger, but the more visible, more braggable aspects to really be able to flourish. And just like the road system that I just referred to, it doesn't really matter what your awesome sports car, like say your new cool OR suite with all of its neat technology, like it's never going to move at its full potential without the proper infrastructure there to underpin it. And so we know this is a common problem.
Yeah, so I would start first in saying we have to stop with all the Band-Aids. And I know that's going back a little to what I said earlier, but how many of our sterile processing departments have washers or sterilizers that are on their last leg and have been on their last leg for as long as you've been working there? And we know because it's always a critical phone call in the middle of the night on a Saturday night to Biomed or to a manufacturer service department to say, this is the only autoclave we have, or it's the only washer that can do this, and we need you to come in tomorrow. And these service companies, we're paying them an arm and a leg to come out in that critical service again and again and again and again because we're unwilling to make that upfront investment and say, okay, this autoclave, for instance, in one of the departments I worked in Kentucky, we had an autoclave that was older than I was, and I wasn't that young at that point. And so you have to be saying, at some point, we've got to look at all of our equipment in sterile processing and really start that preemptive move to budget and replace equipment, not after it breaks and after this news story hits. Now we're delaying all of these surgeries and frustrating all these patients. We've really got to make those decisions before it hits the fan.
And typically, I mean, I gotta talk the VA up because normally the VA is very good about when anything is questionable, they tend to be the ones who just shut it down. And from one perspective, that's a good thing that they don't just kind of sweep it under the rug and keep moving on. But they are very good to shut it down. But when we start looking at things as, well, do we keep the surgeries going because that keeps the patients moving, or do we shut it down because it's probably safer? Well, that ignores option C over here, which is fix it before it became a problem. That really is the best option. So, Bob, I'm going to throw it over to you. I know you interact with hospital administrators quite a bit. How would you make the argument to a hospital administrator that says, hey, you've got a boiler that was installed in 1949, you need to have this fixed, and the administrator looks at you and says, well, it hasn't been a problem yet?
Yeah, the thing that's blowing me away, if I were an administrator in a hospital and I'm seeing these things happening week after week after week, I would be the one going to my department saying, tell me the status of the equipment. Do we need to get this stuff upgraded? I do not want to be on the news. Mm-hmm. And you're going to hit the news. And that's the thing that blows me away. I don't understand why we're seeing this stuff literally every week. And administrators are seeing it too. They watch the news like we do. Ironically, one of my facilities that I was at kept asking for money to renovate one of my departments, and no, can't do it. And then one of our facilities guys came down and worked in decontam and said, you realize like that one whole wall is mold? And I said, I've seen it, and we clean it as quickly as we can, but he said, there's no cleaning that. You're infested. And as soon as that word went up to administration, I got a lot of money and we refurbished the entire department. But it's frustrating that it takes things like that. Why can't we just stay on top of it? And in the military, we had something called preventative maintenance, that once a week we went down to the motor pool and we worked on all of our vehicles and had a ton of checks that we had to go through every week. And it happened regardless of whether or not it was a brand new truck or an old truck. And you would think we'd be doing that in our healthcare facilities where we would want to stay on top of this stuff. But yeah, it's a challenge all the way around.
As soon as you say preventative maintenance, it immediately makes me think about, from a clinical perspective, that any clinician will tell you that it's always safer, faster, and cheaper to prevent disease rather than treat the condition after the person has already come down with symptoms. It's easier,
Absolutely.
it's faster. And so it's the exact same thing when you're talking about your infrastructure, that it's easier, it's faster, and it keeps you out of the news. And in the long term, it's probably going to be a lot cheaper to take care of things before they become a problem. It's that key phrase of preventative. Real quick before we close, any closing thoughts, guys?
Can I throw something else out there
Yeah.
just from the disabled veteran perspective? I have to tell you that I have received nothing but exemplary care from them.
Mhm.
They have taken truly stellar care of me. They're polite. Every time I go there, everybody, even veterans, are thanking me for my service. And I think sometimes we can beat up on the VA a little bit, but they're doing a lot of good. And I think, like the point you made, when stuff like this happens, they're the first ones to shut stuff down
Yep.
and get it fixed. They're thinking patient first.
Yep.
And,
Absolutely.
even though people are getting pushed off, although I'm going to peek at my phone real quick because I got a message tonight from the VA. So they've got something called the Mission Act right now. They understand the backlog that we're having, and with this Mission Act, they're allowing disabled veterans to seek health care in their community as opposed to going to a VA medical center. And this is really a huge step for him. And they're talking telehealth and all kinds of really cool stuff. So they're really, in my opinion, they're up in the game. And I think it's really, really great that they're doing that.
Yep. And you bring up a good point that this makes news oftentimes because it's a shutdown. So that makes
Yeah.
news. And you do have to respect the VA administrators because they know that when they make this announcement to shut something down for patient safety, that it's going to broadcast on the news. And yet they're willing to take that hit because it's the right thing to do to keep the patient safe. Again, that's reactive rather than proactive, but
Yeah.
at least it's not sweeping it under the rug and saying, well, let's just keep the surgery schedule moving. Because I think there's a lot of non-VA facilities that would do exactly that. So you're absolutely right. The VA does a great job, and we want to be careful not to fault somebody for doing what was right in the situation, even if we do have the ability to look back and say, well, here's how we probably could have prevented it. But now that we can't prevent it, how do we move forward? So you're absolutely right. That'll do it for this episode of Beyond the Headlines. I'm Mike Matthews. That's Hank. That's Bob. And we'll see you next time.